Greetings. Good morning to everyone, and welcome to this morning's news conference here at the National Press Club. We have a very important special report to share on poverty, on race, and the pandemic. Members of the media will engage your questions at the end of the remarks and presentations. We'll respond to those of you at the National Press Club and media that's asking questions remotely. It's via press@poorpeoplescampaign.org. We'll be monitoring that and be able to engage that at the end of the press conference. Feel free to send your questions anytime during the news conference so they can be put into queue. Now we'll get right to it. I'm Faith Morris, and I'm serving as your facilitator. Thanks to all of you who are here, and again, have a great morning.
What does the Lord require of thee?
Every one of our representatives here in West Virginia told us no. We're not going to consider policies for the poor, the underprivileged, the underprivileged, the suffering, our vets. No, we're not going to think about them before we make a policy decision.
Hi, my name is Pamela Rush. I'm from Lowndes County, Alabama, and I live in a mobile home with my 2 kids. They charged me over $114,000 on a mobile home. They're falling apart, and then all animals coming in my house. Possum. I trapped 4 possums in my house, cats and stuff. And I got raw sewage. I don't have no money on power. And I have to travel back and forth to Birmingham to take my daughter with the CPAP machine. Don't have a car and don't have no way to take her. And then we have a high utility bill, and the trailer don't hold no air and stuff in it, so it just, the power bill, I couldn't buy my children stuff for what they need.
Now Bishop William J. Barber II, co-chair of the Poor People's Campaign and president of Repairers of the Breach.
Even as short as 1 minute ago, we found out about another person of poverty and low wealth dying because of COVID and because probably of the way we have not paid attention, as this report will show. Woe unto those, Isaiah 10 says, those who legislate evil and rob the poor of their rights and make women and children their prey. 54 years ago, Reverend Dr. Martin Luther King Jr. was murdered. Today, as he begged this nation to address poverty, racism, and militarism. It is shameful that today we have 140 million poor and low-wealth people in this nation, 43% of our people, and 52% of all children. And even in a global pandemic, there hasn't been a systemic or systematic assessment of the impact of COVID-19 on the poor and low-income communities. COVID-19 data collection does not include data on poverty, income, or occupation alongside race and pandemic outcomes. The Poor People's Pandemic Report addresses this knowledge gap and exposes the unnecessary deaths by mapping community characteristics and connecting them with COVID-19 outcomes. The finding of this report reveals neglect and sometimes intentional decisions to not focus on the poor. It is further evidence why we have called for the president at the White House to meet with a diverse delegation of poor and low-wealth people for some 9 months now, and to meet with religious leaders and economists and public health leaders to put addressing poverty and low wealth at the front and center of our nation's moral agenda. This report shows why we must have a moral meeting in the nation's capital, bringing together on June 18th mass poor people's low-wage workers assembly and moral march on Washington to the polls as not a day but a declaration that our movement and our people, we cannot wait any longer, and will intensify and embolden our agitation for this nation to have a third Reconstruction that fully addresses poverty, racism, ecological devastation, denial of health care, the war economy, and the false moral narrative of religious nationalism. We must shift the moral narrative, and this report is further evidence. We must put a face on human abuse and social and political and policy murder. We must build power and refuse to be silent anymore. This devastating report shows that even after more than 2 years of this pandemic, we do not have a systemic way, an assessment of poverty and income and its impact on COVID-19. But we've seen these impacts on the ground in the PPC. You'll hear from testifiers today who were impacted. You'll find the stories about people where, for instance, in one family, one young lady lost 23 members as of today in a family in less than a 30-mile radius. So when I asked Brother Jeffrey Sachs, when we were in Rome with the UN Sustainable Development Solutions Network, which is a network of economists, researchers, and scholars, I said to him, if we could partner with them to do what hadn't been done, he agreed. And with our policy director, attorney economist Shali Gupta Barnes, and our public health team led by Dr. Sherelle Barber, and all of the researchers that you will hear from today that work with Dr. Sachs, they worked hard to dig into this and to identify what we wanted to look at: poverty, income, race, geography, insured status, and put faces, facts, and figures together. And I will tell you that this report reminds me of a scripture in the Bible: the things that we feared the most have come upon us. The findings we will hear today are shameful. They should create a social sadness and a righteous anger among people of conscience. What you will hear today will shock you, because as a nation, we do not talk about poverty. And yet, in the pandemic, we will hear that there have been 2, 3, 4, 5 times the deaths in poor communities as in rich ones. We must talk about this. We cannot say, based on the research, that this is because of individual choices or behaviors. Something deeper is at work. Systems that prey on poor white folk, poor black folk, poor indigenous people, poor Asians, poor Latinos. We say to everybody, walk through this data as hard as it is to look at, take the time to see what has been so far unseen. The findings are so contrary to a nation that claims first and foremost to establish justice, and certainly contrary to the call of God to care for the least of these. And remember, this is unnecessary death that happened. That COVID-19 did not discriminate, but we did. And our discrimination created terrible blind spots that produced the burden of death on so many families that did not have to experience it. And all of this happened while we gave corporations $2 trillion. The corporations made $2 trillion. And while 84% of all the money for COVID relief went to banks and corporations, this, what we have seen, is a gross example of what Naomi Klein calls the shock doctrine, when the wealthy exploit tragedy to increase their own profits while the poor suffer and die. This report shows that a poverty-producing and sustaining system is also a death-dealing system, that there is death measurements in every measurement of poverty, every unnecessary measurement of poverty, when we hide behind the lie of scarcity. And within this analysis, we can also see, finally, it did not have to be this way. If only we were honest about poverty and systemic racism and the systems of violence that showed this tragedy. We are not here to celebrate a damn thing. We're here to mourn. And we're here to mourn to the point that we stand up and fight. We're here to cry until it shifts our souls. We're here to be sad until it makes us stand up. We're here to ask for the compassion to cry with those who are crying, so that we might stand with those who need to be stand, because in this instance, those are us. We're here to realize how unnecessary this has been. This is painful truth, but we must confront it before we can ever heal. There can be no healing if we go around it. There can be no healing unless this nation looks at, talks about, sees, and listens to poor and low-wealth people, and we confront these gross systems of injustice. Let me now turn this over to Dr. Jeffrey Sachs, our brother, who is one of those mourning researchers. Whenever he comes, people say, oh my goodness. But I love him for that, because he doesn't try to toe the line of comfortability. He doesn't try to toe the line of finding out what people will like. He dares, with the gifts God has given him, to speak the raw truth, which is the only way we can get to revolutionary healing. Joining us from Cairo, Egypt, would you welcome Dr. Jeffrey Sachs? Thank you.
Bishop Barber, thank you for your leadership, for helping our country to restore a moral direction. I hope you can hear me. I'm hearing music in the background. I don't know whether that's on my side or for everybody. If that could be turned down a little bit, that would be helpful for me. Thank you. I'm in Egypt today because Egypt is going to be hosting the Global Climate Conference at the end of this year. So I'm working with the government on another tragedy that is especially hitting poor people. Today, we're talking about the pandemic. And Reverend Barber knew the truth. He knew it because he knows, in speaking with poor people around this country, the disproportionate suffering of poor people during this pandemic period has been absolutely extraordinary. But Bishop Barber also knew our government is not counting this fact. It is not telling this story. We don't have the data that are systematic to show how much the poor have borne the burdens of this pandemic compared to the rest of society. People of color, essential workers, low-paid workers, have kept our country going forward. Rich people were able to retreat. They were able to work online if they were working. They were able to retreat to safe locations. They were not the essential workers for our country, delivering, preparing the food, helping poor people in the hospitals and in the clinics face this pandemic. And so we know that the burden has been disproportionate, but we haven't been able to know with precision with the data because the government has not been systematic in collecting it. In our pandemic report card, absolutely, completely inspired by Bishop Barber. And I want to thank the research team at the Sustainable Development Solutions Network, at the Poor People's Campaign, and many others that have been involved who have done brilliant work. It's a bit of a detective work to be able to draw what we do have and to say, look, the poorest counties in our nation have borne the brunt of this crisis. The low-wage workers have borne the brunt of this crisis. People of color, counties that are high proportion of minority group and people of color populations, Native Americans, indigenous peoples have borne the brunt of this pandemic. We call on all Americans, but especially President Biden and our leadership, to look at these data, to understand how unjust this system has been, and to take actions to rectify it. Most importantly, I would like to join Reverend Barber's call for something very simple. President Biden, meet poor people. Meet the people that Reverend Barber has been mobilizing and representing. They want to support you. They want to support this administration. They want to support change. But meet with them. It's no good keeping poor people who are always disempowered away. They can speak the truth. They can tell you the reality on the ground. Mr. President, it's time to meet with them in the White House. And Reverend Barber has been asking for that since even before the inauguration. It's time. And this report is all the more reason for having that meeting. And so I think what we find today, it's not the definitive report because we don't have the definitive data. But boy, what it shows is exactly what Bishop Barber has just said. It shows a story of profound bravery and difficulty faced by the most vulnerable people in our country who have kept our country running, who suffered the biggest job losses, the most economic dislocation, rental evictions, and disease and death because they were in the front lines. They could not withdraw. They could not safely stay away. They worked for all of America. And we have a debt to pay. We have a moral obligation to face this truth, to recognize it, and to rectify the injustices in our society. Last week, Reverend Barber, I had the opportunity to testify to the House Oversight Committee, where the majority is calling for a move to health justice, to Medicare for all, to universal health coverage. I submitted in my testimony data that show how unbelievably broken our healthcare system is. We pay the most, and yet we have the lowest life expectancy of our peer countries because poor people are not being taken care of. That's the gist of this report. Let me turn it back over to you. We have the experts that wrote this report. I congratulate them. The message is clear. We salute the poor people of this country who have borne the burden and kept our country moving. And we call on President Biden to meet with poor people so that he knows the truth firsthand and can lead the change that is required. Thank you very much.
Thank you, Dr. Sachs. Here for the Sustainable Development Solutions Network lead team, we have Dr. Helen Bond, Associate Professor of Education at Howard University and the co-chair of SDSN, and Elena Lynch, Senior Research Manager.
Good morning. There was a blind spot in our understanding of the impact of COVID-19 on a major segment of our population. That is, until today. This research focuses on a key question. The research is titled, "A Poor People's Pandemic, Mapping the Intersections of Poverty, Race, and COVID-19." It seeks to answer the following question. What was the impact of COVID-19 on the poor? In order to answer this question, we had to undertake an intersectional analysis. That was my role in the research. An intersectional analysis centers poverty and studies how poverty intersects with other areas of vulnerability. This brings us to another question. How do people experience poverty? People aren't just poor. They're poor mothers, they're poor fathers, they're poor children, they're poor ethnic racial minorities, they're poor LGBTQ transgender, they're poor people with disabilities, they're poor immigrants. And so our findings show, based upon previous research and the research that we did with over 3,200 counties, in which Elena Lynch will be sharing with you momentarily, that when poverty intersects with race, age, gender, ability, and other characteristics, we have what we call an accumulation of risk, a compounding of disadvantage. And why is this important? This is important because we need sophisticated policy to address poverty, not only just within a pandemic, but within the disaggregated groups that I just described. Policy that does not address the lived experience is policy full of holes and blind spots. And in order to have better policy, we must have better data. Better data requires the disaggregation or the breaking down of data into various categories to increase the visibility of those who have not been seen. I'm going to hand the podium over to Elena Lynch, our Senior Research Manager, who will share with you how we use this data and this study to make visible what has been invisible. Thank you very much.
Good morning, everyone.
Good morning.
Thank you for bearing with me as I set this up. Okay. I'm going to be explaining a little bit about the results of the research that we've all... Oh. I'm going to move to a browser in just 1 minute. So I'm going to speak to you today about the findings that we found in this report. First, I wanted to thank some of the authors who won't be speaking today. So thank you to Miriam Rabi, Anela Layugan, Laura Nora, and Sarah David, who also contributed very much to this report. I wanted to show you just quickly that we put together, as part of this effort, a story map and dashboard where you can look in detail at the different counties and the data that has been seen. If you also go to this website, you'll be able to see all of the details and all of the details and graphics that I'm about to share with you. Okay. Thank you. Okay. So first, I want to talk a little bit about the approach and how we found these findings. We analyzed county-level data on COVID-19 deaths, poverty, and race. We also looked at unemployment, rent burden, and police violence. To do this, we sorted counties into groups based on the county median income. So we made a long list with county income, median income, from richest to poorest counties. The results describe differences across these county groups. So we looked at over 3,000 counties and we sorted them into 10 groups of about equal population, with the most wealthy counties in the first group and the least wealthy counties in the last group. I should say here that there's no one county, there's no county that is completely homogenous, that's all the same. There's no county that's 100% rich people, and even the richest county, there are 8% of people that are living in poverty, and even in the poorest county, there are 6% of people who are not living in poverty. No county is all one race, religion, there's a variety of genders and other abilities within any county. What we can't say in this report is who are the people that died in each county. But what we can say is that in the poorest counties grieved twice the number of deaths than the richest counties. How are we talking about poverty in this report? We talk about people living at 200% or less of the poverty line. Practically, that means that under $28,000 for a single person, or someone who's making $55,000 in a household for a two-parent, two-child household. Here are our main findings. One of the main points in this report is that practices before COVID-19 created the conditions for unequal pandemic outcomes. Many of SDSN's reports point to the fact that the US was already lagging behind other high-income countries around the world. Health scores were going down if we measure them using the Sustainable Development Goals, or the SDGs, and life expectancy was decreasing in the US prior to the pandemic. What we found is that approximately 2 times as many people died in the poorest counties than died in the richest counties. The bar at the top shows the richest counties. That makes up counties that have a median income of $142,000 to $90,000 a year. And the counties in the bar all the way to the bottom represent counties that have a median income of $12,000 to $46,000 a year. You can see that the bar at the top goes only half as far as the bar at the bottom. Similarly, if we break up counties into groups based on how many percent of the people living in poverty, the richest counties have between 8 and 19% of people living in poverty. The poorest counties have somewhere between 42 and 94% of people living in poverty. Those poorest counties experienced, again, about twice this number of deaths as the richest counties. Another way that we broke down these results is by looking at phases of the pandemic. A recent Pew report broke down the phases of the pandemic into 6 distinct phases. This is because as the pandemic has evolved through variants, policies and practices have also evolved. Here you'll see a graph showing differences in deaths across pandemic phases. The blue line represents high-income counties. The red line represents median-income counties, and the green line represents low-income counties. With the exception of that first peak at the very beginning all the way to the left of the graph, you'll see that the green line far exceeds the blue line, which is high-income counties, in every other phase of the pandemic. During the third wave, death rates were 4.5 times higher in low-income counties than they were in high-income counties. You can see the second wave, there isn't even really a wave. The blue county stays low, while the green and red pop up. Death rates were 5 and 3 times higher during the Delta and Omicron phases in low-income counties than in high-income counties. Much of this, although there are some differences in vaccine rates, vaccine rates do not explain the full differences across these counties. As has been mentioned, there is a racial component to the difference in experience across these counties. The maroon squares represent counties that have high percentages of people of color and high death rates. You can see that these squares are clustered across the south and southwest regions of the US. Counties that have disproportionately more Black residents, we consider that more than 13.4%, had a significantly higher COVID-19 rate than counties that did not. Although more white people overall died from COVID-19, the disproportionate rate is in communities of color. We can zoom in on just that poorest tenth of counties, the 10% of people who live in the poorest counties, and here you can see the geographic distribution of those counties. Many of these counties are that dark maroon color, which represents counties that have high percentage of people of color and high death rates. You can also see that the poorest tenth of counties are spread across every region in the U.S., but they are disproportionately in the south and southwest of the U.S. Finally, we looked at the 300 counties with the highest death rates, the deadliest counties. This map in the dark green shows counties that have high incomes, and in the white color shows counties that have low incomes. Outlined in black are the 300 counties that have the highest death rates. Those 300 counties are often small counties, but they also include very large ones like the Bronx and New York. The deadliest counties have higher percentage of people living in poverty and higher percentages of people of color. I'm going to leave it there. If you have questions specifically, you can contact us here. If you'd like to get involved, you can reach out to our partner organization, SDSN USA, at sdsnusa.org. Thank you.
Let me ask you one question.
Sure.
I think it's an important distinction. The percentage in terms of black people who died was more than white. Testing, is that better? The percentage of, in terms of like 10%, 20%, but in actual raw numbers, more white people died.
Yes, that's
We want to make sure to me, because sometimes that's what messes us up in this country. We racialize poverty to the point, and this report shows that the breakdown is still, you might have, like in poverty, 60.9% of black people are poor and low wealth, and 30% or so of white people are poor and low wealth. But that 30% of white is 66 million people. That 60% of black is 26 million. And it's important for us to make these distinctions to the media, because what some folks say, oh, well, what they're saying is just more black people die. And what we're saying is poor people die.
That's exactly right, yes. More white people died. There are more white people in this country, and more white people died from COVID-19 than other races. We're also saying that disproportionately the burden was on people of color.
Right, in terms of percentage. But even in the raw numbers, more white poor folk died.
Absolutely.
Y'all hear me? I want us to make that, because this country doesn't want to do that. And that's what leaves us politically in a mess. Black people experienced a higher percentage, right? More percentage of us in the population. But if you sat down and did 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, you would have more white people who died related to poverty and inequality than you did. And we have to tell both stories and not either or. So that's why I wanted you to say it. And I thank you so much, because you all did a great job of that in the report.
Thank you.
Thank you.
Hi, everybody. My name is Shali Gupta-Barnes. I'm the Policy Director for the Poor People's Campaign and for the Kairos Center. And we've heard a lot already, but I wanted to share 3 points that start to bring some of all of this information together. First, I want to pay a little bit of attention to how we define poverty and why that matters. We define it more broadly than the official poverty measure because current measures are just too low and leave too much hidden. So we redefine it to include everyone living anywhere under 200% of that measure, which Elena said is about $28,000 for a single person and $54,000 for a family of 4. Still too low, but we just double that. And what this allows us to see is both the true extent of poverty and economic security, which we don't always see because of those definitions. And this brings me to my second point. We also see that poverty was not tangential to the pandemic, but deeply embedded in its geography and its timeline. The deadliest phase of the pandemic was in late 2020 to 2021, this winter surge. Death rates were 4.5 times higher for poorer counties and richer ones during that time. After this phase is when, this is when vaccines become available to the general public. But then we get Delta, and death rates are 5 times higher for poorer counties And after that, Omicron, and death rates are still 3 times higher for the poorest counties. We can't explain these differences just by vaccination status. Again, as we heard, something deeper is at work. And this brings me to my third and final point. Why do we pay attention to this timeline? What does this tell us? Is that too often we blame the poor for what are really systemic policy decisions that are outside their hands, decisions that are made for poor communities, but decisions they would never make themselves. Whether that's around what the minimum wage should be, whether that's around who has health care or paid leave or child care or how much debt we owe or who has enough to eat, who has clean water, how much, what water we can drink. These are all policy decisions, choices, meaning that policy makers decide these questions, not the people whose lives are impacted by those decisions. And now, with this data and this analysis, we can see that who died during the pandemic, especially in these phases, in these worst phases, was also a policy choice. It was a choice to not see poverty, whether it was white, black, Latina, Native, Indigenous, or all of the above. It was a choice to have these death rates and to not prioritize the poor across race, across geography, in the worst public health crisis in this country. Now, we know this wasn't just one policy. It was years of policies that predate the pandemic, but also continued through it and even now. This isn't how it has to be. We can make different choices, and we can choose to fight poverty, not the poor.
We can choose to fight poverty and not the poor. I want to ask our co-chair, Reverend Liz, to come and stand with me as we stand with some people who are coming. And Faith, that sign right there, based on, I'm hearing the one that says kill 2 times more. I want to make sure that we add the Delta variants, hold that up, surrounding them on each sign, because I want folk to think it's just 2 times more. In some cases, it was 5 times more. We have some persons here to testify, do some 1-minute testimonies right after Reverend Dr. Liz. And I wanted her to come because she keeps us reminded all the time that poor and low-wealth people are the leaders and are the greatest moral voices in this country. And those of us who work, who either grew up or work with, learn from those folks. But I want you to see one thing that'll slip, especially those of you listening in the media. We identify poverty and low-wealth 200% poverty rate, which means that in this country today, this country tries to tell you if you're single and you make $14,000, you're not poor. I want you to get underneath the numbers. See, part of what we have to do is interpret underneath the numbers. This country is saying today that if you're a family of 4 and you make $27,000 a year, you're not poor or low wealth. So even if we had used the measurements that most of all researchers that are worth their weight in gold will tell you, those stats don't apply if you're serious about looking at these issues. So we're going to ask Reverend Dr. Liz Steele Harris, and then we're going to ask Dr. Sherelle Barber, Director of the Urban Center at Drexel University, to come. Each of them will come for 2 minutes, and then we're going to hear from persons directly impacted. Bruce Grawl from Wisconsin's Poor People's Campaign. We'll also listen to Brother Tyrone Gardner, who experienced COVID, if he doesn't mind me saying that, him and his wife, in Goldsboro, North Carolina. And then we'll be joined by Jessica Jimenez of the New York Poor People's Campaign. And then we will hear from Vanessa Nosey a member of the San Carlos Apache, an Apache stronghold from Arizona. They will come and speak, and then following them, we will have John Cavana. I want to give John a special hand with IPS, because IPS has stood and stands and fights and struggles with us in so many powerful ways. And then our executive director for the Poor People's Campaign's Mass Poor People's Low-Wage Workers Assembly, Mara Marshall in Washington on June 18th, will come and close us out, and then we will take questions. So if all of you would prepare to come in that order and the time limits that have been allotted. Thank you.
You've got to let us wail. As my dear sister, a leader in the Poor People's Campaign, Callie Greer from Selma, Alabama, said, "You've got to let us wail. Wail for our children, our elders, our siblings who are no more." As we've heard these findings presented, COVID-19 in these yet-to-be United States, especially after that first wave in early 2020, has been a poor people's pandemic. COVID has been a poor people's pandemic, exposing and deepening the pandemics of racism and poverty, ecological devastation, the denial of healthcare militarism that preceded and have continued through it. Over the past few years, we've heard about how COVID is a great equalizer. But as we are showing today, it is in fact the poor, the low income, who have been hurt first and worst and are feeling the greatest loss still. We had warnings. We gave warnings that poverty kills. Because as folk have heard from Bishop Barber and the Poor People's Campaign, a nation that has more housing and medical technology and GDP than we can ever imagine, it allowed 250,000 people to die from poverty every year. As we've been saying, as Bishop Barber's been saying, our nation has gotten accustomed to death, especially when it's the death of the poor. Therefore, to hold up this report, to look at it, is to hold up a mirror on our nation. And when we hold up that mirror, we see a nation that had 87 million uninsured and underinsured. We see a nation that had 39 million workers making less than a living wage before that pandemic ever hit. And a nation that continues to refuse to expand health care in the worst public health crisis in generations, or raise wages to the very workers who cannot afford the essentials of life. We see a nation where 14 million families before this pandemic couldn't afford their water bills, despite the fact that Dr. King 55 years ago today said, how is it to have people who can't afford their water when the world is made of 2/3 water? And we've allowed more than half of our children to live in insecure homes, not because there's not enough food, but because we'd rather throw away more food than it takes to feed every person hungry across this world than to actually pass the policies that would lift the load of poverty. And all that poverty, all that inequality has just made COVID worse for everyone, not just the poor. It was pre-existing conditions that allowed COVID to spread. It meant a death sentence for hundreds of thousands, now close to 1 million people, especially the poor, especially the low wage. As Bishop Barber said, we'll hear from some people today to make more of these connections, not just to tell their stories of pain, but to show the power of the 140 million people in this country who are poor or one emergency away from desperate economic ruin. People who are fighting every day for their lives. Also in this room with us are faith leaders and policy and public health experts and community members, all of us who have been impacted, who must organize as we mourn.
Dr. Barber, if you would stand at the podium but allow Jessica, with the Poor People's Campaign, she has to go to class, and we certainly want to hear from her. So she's going to come on the screen, I believe. Hello, Jessica.
Hello everyone. Hello. Can you hear me? Hello?
Yeah.
Yeah, can you hear me? Hello everyone.
Yes.
Hello everyone.
Yes.
My name is Okay. Hello everyone. My name is Jessica Jimenez. I am a single mother of 3 boys. I live with both my parents in the Bronx. I work as a caregiver and I've been doing that for 10 years. COVID has affected many people, including myself, not making enough money during the pandemic to cover my bills, and whatever little bit of money I was receiving, I had to use that to make sure I had food on the table for my children. Coming from a low income family in the Bronx, it was one of the scariest moments of my life, not knowing what would happen. Watching my little sister work very long hours at the hospital. She worked at the hospital and, she got COVID 3 times, and, it was very scary. Watching my father lose a lot of his very close friends was very heartbreaking to see him very sad and shocked of all, losing all his friends. It was just a sad moment and very heartbreaking for me to watch. Watching my kids scared, asking all these questions and confused, like, Mom, why can't we go outside? Why can't we be around people? It was just very heartbreaking, and it took a mental toll on them, not only them, but on myself and everyone else. Not being able to pay my rent and bills on time was one of my biggest worries. I was scared not being able to have a home for my children, not having a rent control apartment, not getting any help to pay bills. And it was either paying my bills or is having to spend that money on food and things that were necessary for my children. Today, I still owe some rent. Unfortunately, I had to close some of my cards because I was using my cards to pay some bills, and I wasn't able to pay them in months, so I had to close them out. And this is why we need the Poor People campaign, and this is why the Bronx needs the Poor People's campaign, because nobody else is fighting for us, and we need to do this together. Thank you.
Somebody hurting our people. Going on. Far too long. We won't be silent. Anymore.
Yes. Good morning. I'm here today representing my public health colleagues on the COVID-19 Health Justice Advisory Committee and many more around the nation who are appalled and outraged at the tragic, avoidable, and unjust loss of life that we've had to witness over the past 2 years. This poverty and pandemic report is painful. An invisible airborne virus has proven to us that we are caught up in an inescapable network of mutuality and has shown us with vivid detail the deadly consequences of systemic poverty and systemic racism in our nation. But even more troubling is our inhumane acceptance of mass death and our rush to return to normal at the expense of equity and justice. This report confirms that our actions have been inadequate, especially during the deadliest waves of the pandemic, and that as a nation, we value profits over people and individuals over the collective. Many of our public health and healthcare systems and local, state, and federal decision makers fail to use comprehensive public health mitigation strategies that center equity and justice, have failed to fully address the structural drivers of the pandemic and its economic impacts, providing only inadequate short-term economic social relief, and have consistently failed to protect and provide for low-wage workers. Our tiered and fragmented healthcare system left at least 87 million Americans uninsured and underinsured before the pandemic, an issue that has been magnified and will especially be detrimental for individuals suffering from the debilitating effects of long COVID, a topic that we're not really talking about. Individuals who are incarcerated and detained have been discarded to the shadows of this pandemic, left to die at 5 times the rate of the general population. Decision makers have failed to address global equity in vaccination, prevention, and transmission control, instead choosing a narrow focus on national interests, financial gain, and corporate profits that have left low and middle income countries devastated and limited our collective ability to prevent unnecessary loss of life. If you don't hear anything else, the pandemic isn't over until it's over everywhere. And our failure to center global equity as we fight here in the US will make the pandemic continue. We are inextricably linked, and we need to be focusing on that. And then finally, as has been talked and discussed here, and that is evident from this report, our glaring omissions of individual level data on income, poverty, and occupation in local, state, and national data systems has left an evidence gap that limits our ability to know the full extent of the harm to poor and low-income individuals and communities. As our nation reaches the grim milestone of 1 million COVID-19 deaths, we echo the Poor People's Campaign's declaration that everybody has a right to live. And we are committed to joining the fight for a way forward that centers equity, justice, and dignity, redresses centuries of policy violence, and honors our shared humanity. Justice demands nothing less of us, and our collective lives depend on it. Thank you.
Somebody been hurting our people. It's gone on. Far too long. And we won't be silent anymore. My daughter has the unenviable job of counting death. So I understand her tears. That's what she does. That's her job, is to count death and to look at how our systems are killing us. I hope you heard that she said about our imprisoned brothers and sisters, and that includes people who went in, maybe incarcerated, not even guilty, but even if they were, they didn't get a death sentence, but they end up with one. And I hope that you hear what's so hard to put a handle on this murderer, because it's not necessarily the murder of commission. It's the murderer of omission. So much so that if you are bothered by hours of potential tape being missing in the White House, What about thousands of points of data that the nation didn't even keep or track? So that when you raise a cry, folks say, what are you crying about? We don't have any data. Well, there is data, but we gotta have folk like this to go find it. How many of y'all want to thank them for digging? We want to always put a face. So Fred Womack from the Mississippi Poor People's Campaign, remotely, would you speak to us now?
Good morning to everyone.
Good morning.
Okay, thank you. Nice to finally meet Pastor Barbara and so forth. The coronavirus had hit our family real hard here in Mississippi, especially in the Jackson Central area. We went through periods where we lost 3 or 4 family members, at a time. Having 4 funerals in one day, due to this COVID outbreak. A lot of I was listening to some of the data they were speaking of here. A lot of the people were dying from the COVID. However, they wasn't reporting in that format that they were dying of the COVID. But a lot of my family and friends had died with the COVID-related illnesses that had put a lot of burdens on a lot of these families. Burial insurance, a lot of things like that. People in this area just can't afford on no constant basis. So, with this unexpected death of the coronavirus, a lot of family members have to, reach in their pockets just to bury their loved ones. We don't did that over and over and over again to where it almost became systematic of what we got to do to bury the next loved one. Also in addition to the outbreak and the toll that it had on our families and so forth, the people in our surrounding area, it led to a lot of violent outbreak amongst the communities and in the city. And, I did with an organization called Operation Good, in which we tried to help curb the violence epidemic that we have here. However, with the coronavirus pandemic going on, it increased that load, which put more burden on people because the coronavirus turned on a new wave of violence in our city, where a lot of people was closed in and left with no hope, and it led to a lot of violence. Where I don't know if you all pay attention to the national news, it led us to the highest murder rate in the country. And a lot of that, the majority of it, was due to this coronavirus, and the babies that it left out here are practically homeless or out of school with no direction, and it was due to the coronavirus outbreak where they got put out of school during coronavirus. However, they got lost in the shuffle due to their family living situation, and now they just aimlessly wandering the streets, getting into all kind of things, and help lead to a little battle.
And Brother Womack, where are you located?
Yes, sir.
Where are you located?
I'm in Jackson, Mississippi. Jackson, Mississippi, sir.
Jackson, okay.
Jackson.
I got you. Well, brother, we don't even know how to take what you just said, burying 4 and 5 people on the same day, and people then having to suffer the additional dignity of not having the resources. Somebody's been hurting our people, and it's gone on far too long, and we won't be silent anymore. Brother Womack, we look to see you on the front line on June 18th as we continue to make this nation respond. God bless you. Brother Bruce Grawl. Let me make sure I spray this so it's.
Thank you. I'm Bruce Grau. I'm a co-coordinator of the North Central chapter of the Wisconsin PPC. Wausau, Wisconsin is a town of 39,000 known as the gateway city to the Great North Woods. We're 80% white. In Wausau alone, we have over 50% of our people living in poverty. At times, our county's rate of hospitalization and COVID deaths and hospitalization led the states. In the first 6 months of the pandemic, 15 of 18 of my COVID-positive residents in one nursing home alone died, and mostly without their families with them. They died penniless and alone. If the nursing home CEOs had invested in adequate staff and protected the staff, I firmly believe we could have saved many of those people. As a provider, I was left feeling helpless, very saddened and angry. This isn't the only healthcare crisis we've run into. We're facing another one with our drinking water. 100%, all of our wells for drinking water are contaminated with the industrial commercial chemical PFAS, above levels recommended by our state's health department. Now, PFAS is linked to hormone imbalances, low birth weights, diminished immune response, and certain cancers. It builds up in our bodies as we drink it. There's a drinking advisory that's telling us to reduce our intake of tap water, yet sufficient accessible alternatives are not being provided. Now, the city's known about this contamination for over 2 years, kept it to themselves, even designed a $120 million water treatment plant to go online this year without including PFAS reduction. Now, it's hard to get free water if you can't pay for the gas to get it, or a cell phone that's needed to order the filters online. Many suffer physical limitations to carrying heavy, bulky cases of water. Hours for water.
And how did that intentionally impact people with COVID? How did that intentionally impact people with COVID and the deaths in your area?
Well, it made it much worse. I mean, we not only have to deal with COVID, which continues at times at rates that surpass any other county in the state.
Okay.
But now we have this problem with drinking water. How can we get well if we can't even drink water?
Right. Because that's
it's
one of the key things
health.
that
Right.
you needed if you got COVID.
You got it.
Right. If you got, y'all hear what he's saying? If you had COVID, the doctors told you what? Drink, hydrate,
That's
hydrate,
right.
drink,
Hydrate.
hydrate. I had it. That's what all they said. And what he's saying is then they can't even. Right. You have another point? Go ahead.
I do. Thank you. There's no city plan to reach out to vulnerable Wausonians. But we, the people, we're way ahead of the city on this. We know this is a crisis. It's not just an issue to be responded to with half measures like the city has. We ran out of bottled water that the city provided in less than a day, twice. We know industry and profit caused this. The city's reluctant to investigate. On top of everything else, making us drink polluted water is violence. If we ran the city, we wouldn't be going 7 weeks without enough safe water to drink for everyone. We'd make sure we all had what we need now, because everyone has a right to live and thrive, And we're organizing in Wausau to make sure that we have good health care, safe water, and everything else we need. We won't be sacrificed anymore. We'll be here with you on June 18th. Thank
Somebody.
you. Somebody.
Been hurting our people.
Been hurting our people.
And it's gone on.
And it's gone on.
Far too long.
Far too long.
And we won't be silent.
We won't be silent.
Anymore.
Anymore.
And this is why we have to nationalize these issues. It's not enough for one community to fight alone and to have to fight in their city. These ought to be federal rights. You know, just basic. And so that's why we have to unite. We also have at this time to come Brother Tyrone Gardner, who's from North Carolina, Poor People Campaign from Goldsboro, North Carolina.
Hello, everyone. My name is Tyrone Gardner. By the way, I do have a health concern. I have sarcoidosis, which is an autoimmune disease. And so I was stricken with COVID. My wife, she has lupus. She was also contracted COVID. And because I don't have money, it was 17 days before they even told me I had COVID. So in the process of that, thanks to Rebuilding Broken Places and my bishop here, we had a feeding program where I was helping to feed 150 families a day. So 13 days out of those 17 days, I fed children and had COVID and didn't know it. But thank God, none of them contracted it. My brother had COVID, which he's retired from the military. His oxygen level went down to 70%. And the doctors told him to go home, he would be all right. But thank God for Jesus. My aunt had a friend move in from Brooklyn to be close to her. She got sick, went to the hospital, went to the nursing home, contracted COVID, died almost alone. The only way we could really get to her was through the window. To be able to get somebody to let her use a phone, because she was in a nursing home. She died completely alone. Had that government told the people how important and dangerous COVID was, long as they knew it without telling the public, maybe some of the lives would have been saved. So we'll be there from Goldsboro, Wayne County, North Carolina, one of the poorest counties, on the 19th, 18th, 17th, whenever we got to be there, we're going to be there marching, and we're going to get people to the polls, or we're going to get rid of some of these people that care not about people. Thank you.
Somebody hurting our people. Gone on far too long, and we won't be silent anymore. Sister Vanessa Nosey is on the reservation with our brothers and sisters from the Apache Nation. They were already suffering from a multinational company trying to destroy their water veins, but she comes to talk also about COVID-19 and how it hit this poor community that still lives under laws, unjust laws passed in the 1800s. My dear sister, love you, and love to you and your father. Can you hear me?
Yes, I can hear you. Can you hear?
Yes, we can. Thank you so much.
Thank you for having me here. Vanessa Nosey Conce. Hello, my name is Vanessa Nosey. I want to thank you for this opportunity to that you gave us as Apache people and as Indigenous people. We have been suffering since colonization, when the Europeans came and took our lands and relocated us, and we went through so many traumatic things, but that still exists today. You know, we're continuing to fight for our religion, our identity, and who we are as Apache people and as Indigenous people all over this country. But we too have been affected heavily by COVID. I sit on the Tribal Emergency Response Commission as a deputy PIO. And through my experience, you know, as not only as an Indigenous people, but a person who cares and fights for my community here on a land that we were forced on and has tried to make it our home. um, when COVID hit us and COVID came, it was sad to see how those 1800 laws and how they view the indigenous peoples to exist. You know, they came here to sell the vaccine. The federal government wanted the indigenous people that are federally reckoned that are under the Indian Health Service to get the vaccine and use us as guinea pigs to see if it was okay that it would work everybody in this country, you know. And they presented to us, they went to our tribal council, they went to our health cares and really persist on getting us the vaccine first. And they sold it to us in a way, you know, of manipulation. And so we did it, we took it. The federally recognized tribes, most of them were able to get the vaccine, but it wasn't to benefit us. It wasn't to help us at the beginning. It was to see if it was going to be able to give the protection to all people. You know, we were that guinea pig to experiment this vaccine. You know, blessed that it worked in our favor. But it was funny because, well, I shouldn't say it was funny. It was really sad to see how we were first in line to get this vaccine, and then when the numbers came out and all the studies that, yeah, we can push this forward, then it was hard for us to get the vaccine. And that really showed how the federal government thinks about our people, how our lives aren't valued, you know, that they look at us that we can, you know, it doesn't hurt if we don't survive, that
so Vanessa,
where our lives are.
Vanessa, you know how we talk up on the mountain, and I've been on the mountain where you all should know back in the 1800s they made they opened a river. They drove the Apache people to the valley and then went upstream and opened the river so the river would come through at night and kill them. And yes, the Apache people are such warriors that the Apache warriors, when they had them backed up against a cliff, rather than accept death, they jumped the cliff. These are not people who are weak. But I just heard you say that they use our indigenous brothers and sisters as the guinea pigs. And then once they found out it worked, made it harder for them to get the vaccine.
Yes.
And they had to pay for it in the initial. I just want y'all to hear. Take about 20 more seconds. We've got to close out, but take about 20 more.
I think the thing that, you know, with all of that happening and the government choosing us as guinea pigs, what really helped our people was that we took control. You know, I was proud to come from a tribal government and a people and being on the commission that held our people first. And we knew that we had to do everything in our means to protect our people from this virus as long as we could, and that the federal government wouldn't be there to help, that they would continue to push us aside. So as a part of the commission, you know, I was extremely proud. And then back in 2006, between 2006 and 2010, then Chairman Winston O.Z. Sr. walked away from Indian Health Service because it wasn't benefiting our people. And COVID is just a prime example how it still doesn't exist, how we still are at the bottom of the barrel, and created our own health corporation. And our motto was we had to keep our youth and our elders alive. If our youth aren't alive, then we don't have a future.
That's right.
And if our elders aren't alive, then we don't have anything to connect us to our past and who our people are and our religion and our identity, because they hold the key. So that was our purpose, was to keep our.
Yeah, thank you so much, Vanessa. Keep our children alive and our elders alive. Somebody's been hurting our people, and it's gone on far too long, and we won't be silent anymore. I'm going to ask John Kavanaugh and Reverend Dr. Alvin O'Neill Jackson to come, and I want to loose you when we leave this place in the street today to make as much noise, but specialized noise. I want people to not make any mistake when they hear you today, that they will know clearly we're coming, that they will hear the wail and the shout, whatever's in your heart, that you're sitting in here now about to bust. I want you to scream it, wave your sign, declare June 18th, dedicate Pennsylvania Avenue, because we have work to do. Yesterday, before you all come, Roz last night about 1 o'clock shared something with me, that in the Hebrew tradition, 18 is life. The number 18 means life. But it's not a life that goes around death. You can't declare life on the 18th unless you deal with the death on the 18th. The life is talking about is the life beyond the death that systems use to try to wipe you out. So it cannot be an ignoring of the death. It has to be a realistic dealing with it, and then to declare that death will not have the final say.
Thank you so much, Reverend Barber. It's an honor to be here in between Vanessa Nosey and the Apache Stronghold and my brother, Dr. Alvin Jackson, my younger brother, Dr. Alvin Jackson, here. I'm John Cavana of the Institute for Policy Studies, and we're proud to have worked with the Poor People's Campaign for the past 5 years. And 2 weeks ago, Shali Gupta Barnes, who you heard from earlier, and we convened over 40 research and policy groups to join in the march towards June 18th. Today, it is a huge honor to join you in lifting up this amazing new Poor People's Pandemic Report. You're seeing today the power of connecting data and research with people's movements on the ground. The great Russian novelist Fyodor Dostoevsky wrote that, quote, "The degree of civilization in a society can be judged by entering its prisons." In 2022, the same could be said of a society's healthcare system or the laws they've erected around poverty or racism or militarism or the environment. The Poor People's Campaign talks about the need to name policies and institutions that deepen systemic poverty and racism as policy violence. This new data set from the Poor People's Campaign and the UN Sustainable Development Solutions Network maps the intersection of poverty, race, and COVID, and in the process exposes the policy violence that began long before March 2020 when the pandemic first hit this country. This data screams out the conditions in the poorer counties of this country that led to these obscene rates of deaths in poorer counties versus deaths in richer counties. The lack of equity of health care, the lack of equity in dignified jobs, the lack of equity in housing and in education. This data is the wake-up call for this nation to heed the calls of the Poor People's Campaign to embrace a far-reaching agenda for a third reconstruction in the build-up to June 18th. Our researchers at IPS have spent the last week doing what every elected official, every citizen is invited to do today, which is to dive into this website, look at your county, see how many people have died from COVID, understand it, understand their racial makeup, and jump in with the Poor People's Campaign to reverse the violent policies that make these counties poorer. I simply want to say in closing, on behalf of IPS, our Executive Director, Tope Falarin, and our entire staff, I join you today in spreading the results of this in-depth mapping as hundreds of our organizations work together to support a bold Poor People's Campaign agenda to end the pandemic and to end the unequal policies that have led to far more people dying from COVID than richer people. Thank you, and to Reverend Alvin Jackson.
Thank you, Brother John. The gravity of these findings wail
The gravity of these findings scream, they holler. They clearly, boldly, and loudly demonstrate why we need June 18th. But more than a day, a declaration. More than a moment, a movement. Because as Bishop Barber often says, change has only ever happened when people come together for a meeting and summon the political will to be the change they seek. And so people coming together from every corner of the nation, across race and age and gender and geography and class and status and circumstances, people who proclaim faith and people who proclaim no faith, everybody in and nobody out. This is why we are calling all of you here and all of you watching, wherever you are, to join us here for the Mass Poor People's Low-Wage Workers Assembly and Moral March on Washington and to the polls June 18th. We're coming on June 18th, demanding that the findings of this report be addressed and the underlying conditions and systems that have led to so many tragic and unnecessary deaths be addressed. And so we're coming, and we will keep on coming until justice rolls down like waters. We are coming, and we will keep on coming until what is moral and what is life-giving and what is right and what is good and what is fair and what is decent and what is compassionate and what is right and righteous includes everybody and falls like a river, an ever-flowing stream. Following this press conference today, we will gather at least 140 strong, representing 140 million poor and low-wealth people in this country. We will gather at Freedom Plaza to make our declaration and dedicate the site of the Mass Poor People's Low-Wage Workers Assembly and Moral March on Washington and to the polls June 18th. Join us today and join us June 18th. www.poorpeoplescampaign.org. Join us.
Somebody hurting our people. It's gone on far too long. And we won't be silent anymore.
Bishop, did you have anything? Because we're going to open it up for questions now. So is there a final? You ready? Okay, great. So media, we're going to ask you to please give us your name, your outlet, and your question. Can we have our first one? Yes, please. She's coming with a mic.
Hi, thank you. Hi, I'm Deborah Berry with USA Today. As longtime advocates for issues of the poor, was there anything in here that was particularly surprised you, that really kind of threw you, that you didn't think would happen? And what is it why do you think the White House hasn't responded to your meeting? And do you think Congress has done enough to respond to these issues as well?
Testing. We knew the anomalies, so it wasn't a surprise in that, but the depth of it, the broadness of it, the not keeping the evidence, the places of blatant neglect, and in some places, downright intentionality to not measure how poverty and COVID connected. I don't know why the handlers have not responded. I really believe the president desires it. I don't know why this country wants to talk about the middle class and the wealthy, but you can't even get a presidential candidate during the debates to say the word poverty. I don't know why the country continues to dismiss 43% of its people. Actually, poor people now make up 32% of the electorate, and in some places, 45% of the electorate. There's multiple reasons why, I guess. People don't want to face it. They didn't want to listen to Dr. King either. You know, he was killed trying to raise these issues. But what I do know is we're not going to be silent. What I do know is the people are going to be heard. What I do know is we're going to build a movement. What I do know is we can't worry anymore about why they aren't listening. We have the moral responsibility to make them listen. Because if Zora Neale Hurston said, if you smile while people are hurting you, they will kill you and say you enjoyed it. And what we are clear about is that there has never been a listening until there is a massive moral movement. In history of this country, you can't just do it in the back rooms. You can't just do it with just the vote. There has to be a massive moral coming together that changes the moral narrative, builds power among the people that are hurting and oppressed, and presents to the nation an agenda for saving herself. We have all of those things and the people, poor and low wealth, religious leaders and advocates, and we are not going to quit until not only this nation hears, but this nation changes, because she cannot continue to survive and be the democracy she portends to be, with nearly half of her people living in poverty and low wealth. And as this report says, poor people in some places dying at a rate 5 times more than others, while we called them essential. But they were treated in terms of delivery of services and data, delivery of services, tracking their lives as expendable. This is no longer acceptable. And lastly, Faith, we say to America what Joseph Stiglitz said, the renowned Nobel Peace Prize economist, when he said the question for America is not how much does it cost to address the issues of poverty and low wealth. The question is how much does it cost not to? That's the moral question in front of America.
We have another question? Yes, please.
I'm Mark Gruenberg from Press Associates Union News and People's World, and I guess the best way of putting this, what is sort of staring us in the face on the CDC map. I happened to look at that about a month ago. I'd like you to comment on that. When the CDC reduced its standards, published a map, every county in the country. Green, good county. Yellow, you need some precautions. Orange, pretty bad. Scattered yellows and oranges all over the country. One county here, one county there, except Appalachia. Totally yellow and orange. Talk about that for a minute.
Just before Shelley comes, I want you to know better than that. Pam Garrison, are you in here? Is Pam here? She was in here a minute ago. We're headed to Appalachia this afternoon for a 5-day march across Appalachia, going to the coal plants of Joe Manchin, the dirty trash coal plants, where he has blocked many of the things that poor people in Appalachia needed. And so Appalachia is a major part of this movement, because you have to connect Appalachia in the mountains of West Virginia and the Delta in the bottomlands of Mississippi, and all of that has to come together if you want fundamental change. But I want Shally and the researchers to talk about the data and what's different about what that they did at the CDC and this particular piece of work.
So I wanted to I appreciate this question, and just wanted to call your attention. As part of the report, we also developed a few county snapshots where we look more closely at several different counties in the country, including many of the counties that we heard from today. We looked at Wayne County, where Goldsboro is located, the Bronx. We looked at Gila County, where the Apache San Carlos Reservation is. And one of the counties we looked at was Mingo County, West Virginia, which is typical of Appalachia. It's the heart of, the coal miner struggles, the Battle of Blair Mountain. It has a deep and long history of poverty, of resistance. And what we saw when we looked at Mingo County is that not only is it one of the lowest income counties in the country, its death rate at 470 per 100,000 people ranks it among the highest 25% of counties by COVID-19 death rate. This county is 95% white. We have to put and over half of its residents are poor, right? We have to put Mingo County alongside the Bronx. We have to put Mingo County and the Bronx and Apache, the San Carlos Apache sacred lands together. We have to look at those together also with Wayne County, Harris County, Texas, one of the hardest hit counties in the country, Marathon County, right? This is a higher income county, higher median income, but massive poverty, huge deaths. There's something else happening here, and I think the gap that Appalachia falls in terms of whether it's a CDC's analysis or the other studies that are out there on health, on poverty, on COVID, that gap, we are starting to fill that gap, but the consequences of it are we don't ever put Mingo County next to the Bronx, next to next to Apache, next to the South, next to the Deep South. We never put them together. But once we start putting them together, we start to see things very differently, and this is what we're trying to do here.
Let me follow up, and we've got three that are coming on right after this. Three last questions. My sister, USA Today, your question about no, Congress has not done enough. We pushed the BBB because it was a step in the right direction, and then that didn't even happen. And now the child income tax credit has been rolled back. There's been no increase in health care. Living wage that would have lifted 31 million people out of poverty, and 41% of African Americans was blocked by two senators, one from West Virginia, one from Arizona, who were Democrats. And so, no, and we put before the Congress, Liz, this movement, a third Reconstruction, ending poverty from the bottom, poverty to the wealth from the bottom up, a resolution how to do it. Now, 30-some congresspersons signed on, but this Congress and this country has got to take serious a comprehensive addressing of poverty. We have 14 steps for the healing of this nation. The piece we want folk to understand is none of this has to be. That's the point. This is solvable. We do not have a lack. We have to address the lie of scarcity. We don't have a scarcity of resources. We don't even have a scarcity of ideas. What we have a scarcity of is moral and political consciousness and action. And that's why this movement is not going to quit. And June 18th is not just a day, but it is a declaration. We have two more.
But you've actually answered Newsweek's question, so we'll go to Daily Cause. Daily Cause says the biggest question we have to ask is how has a rural refusal, red state refusal on Medicaid expansion harmed the ability to many to get care, hospital closings, etc.?
I mean, this has been detrimental. Yeah, this is Sherelle Barber, social epidemiologist. So that expansion, that lack of expansion prior to the pandemic set the stage for the inability of folks to access care during the pandemic, right? So that was from anything to being able to seek care once they got COVID-19, access to testing, access to vaccines, all of the things that are needed to help to save lives. That was, we didn't have that. And Medicaid expansion, or the lack of Medicaid expansion, made it so that these communities were structurally vulnerable to this pandemic even prior to it, because they were already experiencing limited access to healthcare prior to the pandemic. So that is critical in what we need to understand about why we are here in this moment with the pandemic.
I just wanted to jump in as well. One of the things that was a really important finding, this is Reverend Dr. Liz Theo-Harris, co-chair of the Poor People's Campaign, director of the Cairo Center. And one of the things that folks will see when you look deeper into the report is we keep on talking only about vaccines. We haven't talked about equity, but we also haven't talked about the lack of health care. And in many of the states that were hardest hit, the counties that were hardest hit, amongst poor, there's high double vaccines, but there's low health care. And if that doesn't show that this is a health care question, a public health problem, and again, just to restate what has already been said, the fact that our public health officials do not collect this data then they can't say that it's the lack of Medicaid expansion. They can't say it's the lack of expansion of any health care that is a huge driver of this pandemic, and it has to be called out.
Last one, I hope.
There's one more question, but one more piece of this is that's why we're in this movement now talking about death and social murder, because we should have been talking about that from the denial of Medicaid expansion. There's a death measurement there. For every state that denied Medicaid expansion, people died that shouldn't have. So we have to force this conversation that's not about left and right, but that there are these death measurements, real human beings' lives of every race, creed, and color that die from bad social policy and refusal to follow the facts and the evidence and the science. And we can't ignore it, and we won't ignore it.
With the last question. Yeah, so I'm Dr. Joya Crib Perry. I'm the founder and president of the National Birth Equity Collaborative, and I have to tell you, it's hard for me not to scream at this moment. So a few weeks ago—
You're with who now?
The National Birth Equity Collaborative. I work on—
But are you with press?
No.
Okay, hold on a second. We got to get our press person on. We have
did.
to.
I thought they did.
No, we got one more. And we got to end.
No.
Wisconsin, we have to, sister. We'll come to the piece. Let her take the mic. We need Wisconsin Examiner. Wisconsin Examiner. We have to get them at this time. This is what we promised, all right? Yes. Are they on? Go ahead.
No, this is our online. Some research that came out last week suggested that support for measures to help curb COVID-19, masking, social distancing, temporary shutdowns of businesses where crowds gathered, actually fail, and where the racially disproportionate impact of COVID got more publicity and attention. The question is, who can speak to what we can learn from and do about that research in combination with your findings today?
What we can do about it and what we have to do about it is build a movement. And that movement cannot stop. The movement has to be deep. It has to be broad. It has to be intersectional. It has to address all of these interlocking injustices. It has to say to the nation, things don't have to be like this. In every situation in this history, in this country, when people were dying because of social policy, people had to stand up, whether it was the deaths caused by slavery, whether it was the deaths caused by the early abuses of industrialism, whether it was the deaths caused by Red Summer or deaths caused by the lies about the swine flu, whether it's the deaths that were caused by lynching. There's no way to address death without somebody coming alive and saying that we're not going, somebody, as my dear sister saying, screaming. That's why I just sent Shelley over there to say, get her in the loop. If she wants to scream, damn it, get her in the loop. We need screamers. We need hollerers. We need facts. We need faces. That's the only thing that has ever worked. Only thing. Only thing. As we go to Easter, one of the greatest scriptures for me in the Bible was when Jesus was not recognized as who he was until he was on the cross. It was only when folk were forced to look at the death that somebody who was his oppressor changed. Only when he saw the death. And only if we break the heart of this nation and show how flawed the heart of our public policies are, do we have a chance to transplant the heart and do this thing better. And if we don't, we will be the ones that allowed the demise of that which we claimed we were, but we never lived up to it. Let's go to work, y'all.
So thank you very much. With that, we're going to close the press conference. Thanks to media online, media here, and all the guests participating in this. Thank you much.